welcome to the Dr. Mom Show. It's Dr. D, mom of 3. Good to see you again. Hope you were able to tune into our show last week. We're doing a special series on autism because April is Autism Awareness Month. So if you missed last week's show, it was just the introduction to autism spectrum disorder. Again, don't forget to subscribe to the Dr. Mom Show and share your videos, please. And also, just to reiterate, this information doesn't take the place of your physician or your child's physician. And the resources used for this include the American Academy of Pediatrics. So just to let you know again, as far as the definition of autism spectrum disorder, it just encompasses neurodevelopmental disorders that have 2 major deficits, and that includes social skills and communication, and secondly, just repetitive behaviors and patterns. So today we'll be talking about clinical features that we see in autism spectrum disorders. Again, just to reiterate, it's very important to take your child or your children to all of their well child checks and physicals, just because this is how these clinical features, when you speak to your physician or your child's physician about them, can come up as a topic. Again, one major part is social skills and interaction. So some of these patients, we can see that they don't play with other kids. So for example, if you're at the playground and you have 5 kids, instead of playing and interacting with these other children, kids who are on the autism spectrum disorder may be in the corner just playing by themselves and may not even pay any attention to other children. These kids sometimes can also be very, what we say, emotionless and not empathetic. So if they see a sibling crying, they'll just kind of be like, and move along and not really care or console their sibling or friend. A lot of times they're not interested in new items or showing their parents new items. A lot of kids normally, if they have a brand new toy or they find something interesting, they'll bring it over to mom or dad and show it to them. These children, however, will not do that. In addition, they may not want to cuddle, may not show you that they want to be picked up, so lift their hands. Kind of in my family, it's 3 of them doing that at one time. And sometimes, again, not wanting to be hugged. Other times, these kids, as they get older, may even be inappropriate, and this may be at an older age where they have friends, but they don't have boundaries per se, and they may do behaviors, again, as I mentioned, that may just be inappropriate. Another thing is that they may not point to items. So a lot of kids, if they see a train or a plane, they'll look up and point to it, things of interest, but these children won't do that. As far as other items, it includes repetitive behaviors that we see with kids on autism spectrum disorder. They can do hand flapping like this, sometimes rocking motions or forward and back. And again, we see this repetitively, that they just do it. It's not in times where they're throwing tantrums or anything necessarily, but they'll just do it on their own. A lot of times we'll see these children line things up. So for example, if they have cars, instead of playing with the cars and going vroom vroom, and you know how little boys will crash them and make a whole bunch of noises and say beep beep, pong pong, these children will just line them up neatly and get very upset, going back to what we talked about, repetitive behaviors, that when their routine is thrown off, if somebody was to go and move the items being out of line, they would get very upset about that. These children can also exhibit echoing. So for example, if you say something, or if grandma comes over and she says something, or if they see a movie and there's a line in the movie, they'll keep saying it over and over again, even up to when you lay them down to go to bed. When they're going to bed, you say good night, and they just echo that line over and over again. Sometimes they can even do self-stimulating actions such as licking, also sometimes self-harming items such as biting themselves, sometimes banging their heads, and this is something that happens continuously. These kids have difficulty with change. Their system is very ritualistic. Again, if they have a set routine, they're very regimented and don't want it to be changed. And like I mentioned, a lot of times there's sensory issues, so they don't want to be touched sometimes, and they just sometimes they like repetitive things, as I mentioned, like the licking. These kids can also get preoccupied with items such as a fan, a flashing light, things that are spinning, and then they just keep looking at it over and over again. And these kids will get sucked into doing the same thing and just focused on one thing for a very long time. So for example, if they have a car with a wheel, they may just spin the wheel, spin it, and they may do that for 30 minutes at a time and not do anything with the car. And a lot of times these kids are hypersensitive to noises, and it can be everyday noises such as a dishwasher or washing machine. Before I move on, let's take a little break and let's check out the Tripsies. Put it in, baby. Wow. 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 We're going to put this on the Christmas list. The next thing that we can see with autism spectrum disorder is these kids can have a speech delay. And as I mentioned in the first video, sometimes even an intellectual delay, but they may not necessarily have that. In addition, there may be motor deficits, such as toe walking all the time and never really walking flat on their feet, sometimes being even clumsy and tripping all the time. This is after, you know, they've learned how to walk, because of course when they're learning how to walk, that will happen. That's just normal. And some of these kids will present with large heads. Again, just to remind you, it's very important to keep your child's visits, because at your well child checks, they should be getting their heads measured, and that should be getting looked at. And then some of these kids have what we call special abilities, where they may have delays or may be very bad at something. So for example, if they have a speech delay, but they may be awesome at a musical instrument or math or puzzles. So again, this concludes some of the clinical features that we see in autism spectrum disorder. Again, don't forget to check out part 1 if you missed it, and we'll be airing our part 3, our last part of our series on autism spectrum disorder, next week. Don't forget to subscribe, and don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Bye-bye.